y el doctor Jorge Fernando Orellana Oliva, decano de la Facultad de Ciencias Médicas. Muchísimas gracias a ambas por compartir su experiencia y gracias de nuevo.
Gracias a todo el equipo por la organización impecable. Gracias. Doctor Augusto.
Dear Professor, Research, and Administrator of the different medical education institutions participating in this first International Congress on Technology for Medical Education. Good morning. It is a great pleasure for me to introduce our speaker, Dr. Joshua C. Feblowitz, who is a medical editor and content developer for Minerva Inc. He is an emergency physician at Alton Health at Carroll Hospital in Maryland. He's also a senior medical editor for the educational simulation app Full Code. He received his MD from Harvard Medical School in 2015. This time, he will participate in our virtual fair presenting the software Full Code. Please join me in welcoming Dr. Feblowitz. Doctor, time is yours.
Thank you so much, Kira, and thank you everyone for joining today. I'm very excited to be here. As Kira mentioned, my name is Dr. Feblowitz. I'm a practicing emergency doctor in Maryland, near DC, and I also work on the app Full Code, the simulation app that we'll be talking about today. I apologize at the beginning for presenting in English. I will do my very best to speak clearly throughout the presentation. We'll have some time at the end to take questions as well. So I'm going to share my screen, and after a brief presentation, we'll go through the application and I'll show you some of our virtual simulations. So I'm going to be talking to you today about the use of virtual simulation to improve decision-making skills among medical students and medical trainees, to practice and refine clinical judgment using a safe virtual simulation space. So we will have 10 minutes to go through these slides, and then I will demonstrate a case for you. I want to talk a little bit about modern learners and how we can use serious games to help them improve their clinical training, especially in this time where it can be difficult to have exposure in a clinical setting in person. We will demonstrate one of our cases, and then I will show you how we make these cases and how instructors can use our system to monitor students' progress and success using the platform. And as I mentioned, we'll have 10 minutes at the end to take written questions on the platform, on simulation, or anything else that you want to ask. So we are seeing, especially in the last year or so with the global pandemic, that traditional methods of medical education are not as effective or successful. And that's further limited by the fact that students may not be able to work as much in the clinical environment or may not have the same rotations available to them as a result of the pandemic. But these trends were already present prior to that. And medical education has been moving more and more away from didactic learning in the classroom towards more experiential learning. Clinical experience in the hospital is a vital resource, and it can be very limited. Students may not have enough availability to get the exposure they need. There may be limits in the number of students that can participate, and there can obviously be safety concerns about trainees participating in the real-life clinical setting. A method of supporting education and student learning this way without the exposure in the clinical environment is by using in-person simulation. And many medical schools obviously take to developing a simulation center where the students can go through simulated clinical experiences and improve their learning in that way. So in the last few years, and we're part of this movement, virtual reality has become a greater part of this type of education, virtual simulation and virtual reality. Some of those involve the use of virtual reality headsets, and both those virtual reality solutions and in-person sim centers can be very costly and can be challenging to maintain. So our platform is created with the idea that anyone can use it anywhere on a mobile device or on any computer with an internet connection without the need for any special equipment. So this is the context that we find ourselves in and why we created this platform to allow for a more streamlined and easily accessible platform for simulation for students around the world. So what are the advantages of using virtual simulation or serious games to improve students and trainees' clinical skills? It gives you the opportunity to allow them to have frequent exposure to clinical concepts. They can access things on their phone for 5 minutes while commuting or at a break on a shift. They can revisit that content as they need to and as their time allows. It allows you to engage learners in a much more active learning experience, not simply a lecture or a test, but to immerse them in a virtual environment, give them detailed feedback on what they're doing right, what they're doing wrong. It can also allow you to expose them to things that are uncommon or rare, things that may be seen only in unusual instances or on tests or board exams that they need to pass, things that they may not get regular exposure to in the classroom. But the biggest and most significant advantage that we see is that this allows them to access these resources anywhere. They do not have to be at the classroom or in a simulation center or with any special equipment. They use their phone or their computer to move through simulation scenarios at their own pace and to learn from them. So we derived our platform from modern learning theory on how adult learners absorb and process information. We know that didactic information, a lecture given to students, is not well retained, and that people do not usually preserve that information over time when it's delivered in that setting. So we developed this tool, Full Code, our app, to take advantage of modern learner theory to expose students and trainees to these concepts in a way that will really stick, where they can learn privately on their own time at their own pace, focus on the material that they feel they need to work on, and get detailed feedback on what they did right and what they did wrong, and then repeat that. And that repetition and that availability of repetition in a safe space allows them to solidify that learning and to really embed that clinical knowledge for the long term. So we see our virtual simulation as fitting into a cycle of learning that fits with traditional didactics, in-person learning, and clinical experience, that you can learn the foundations of a clinical case or a specific diagnosis using a virtual simulation platform and apply and understand that information using the virtual environment, that you can then apply it in a group setting or an in-person setting using physical simulation if available, that you can then reinforce that after a in-person session with virtual learning again and be ready to apply that in the real world clinical setting. So this fits into especially students that have limited access to the clinical environment, both before and after in the context of the pandemic, to allow them much greater ability to internalize the concepts and incorporate them into their real world learning. So we believe that this type of platform, that a serious game virtual simulation platform, can give students that unique opportunity to practice in a risk-free way and internalize those concepts. And it allows instructors to gain insight to how students are doing, what their thought process looks like, what key actions they are missing or successful at, and to identify students that need remediation or those who are excelling and could benefit from more challenges. Our system allows you to view in an educator dashboard very fine detail about how a student has thought through a specific clinical scenario, what they've missed and what they've been successful at. And it also gives you a broad measure across many disciplines to evaluate students in different topics, including trauma, cardiology, infectious disease, and many other areas. One limitation of this type of platform is the practice may vary in different locations, that different resource settings may use different protocols, different medications, or different care for a certain condition. And individually, it may vary with different doctors how you may take care of a certain condition. We also are certainly aware that language, units of measure, and the naming of different medicines and clinical procedures may be different throughout the world. So we've created a system that can customize these cases across different environments so that you can design them specifically for your learners. And we do partner with several hospitals around the world who are working on their own versions of these virtual simulation scenarios. Our full library includes 120 cases currently, 125 actually, that are written by Harvard-trained physicians, emergency physicians. And each case allows you to walk through the actions of a specific clinical diagnosis and gives detailed, extensive feedback on the diagnosis and your performance. The educator can then access that information after the student has completed the case. And as I mentioned, you can even have customization, if you so choose, of the cases that you would design on your own. All of this is available on both our Apple and Android app, as well as on the web. You can access it at app.full-code.com, and I will show that at the end of the slides, and will be posted in the YouTube comments as well. Again, so that's where you can look at our virtual simulation platform on your own time, and you can also contact us at this email address if you'd like to talk more about using it with your students. I'm going to switch over to demonstrating a case for everyone. We'll go through a case that's freely available for any of you to play. You can, again, access it at that link and play through it on your own. So this is case 79, a presentation of a confused patient who was brought in by a friend. A young patient who is intoxicated and is found minimally responsive. So already, I hope your clinical minds are thinking through what could be going on. This is your virtual patient. This is your virtual environment that you can explore and move around in, and perform procedures as you feel appropriate. So this patient, you're presented with an unresponsive patient who is 22, likely to be intoxicated, but was found to have had a fall at home. And after that, had a rapid decline in their mental state and became unresponsive. So if you're starting to think about what may be going on in this case, you may think that an occult trauma may be in play, that the patient may be intoxicated on more than one substance, or that they could be having a medical emergency that's not directly related to alcohol use. So there's a broad differential in this case. At first, you get this information up front, and then you work through the case based on your clinical judgment. So the next thing I'm going to do is place the patient on the monitor to get a sense of their vital signs. And we see here that this patient is bradycardic, a slow heart rate, that they are hypertensive, high blood pressure, and that they are minimally responsive and unconscious. Now, in some cases, you can ask more information, but in this case, the patient cannot provide any because they're minimally responsive. But you proceed on to the exam, you find a unresponsive patient who is with a low GCS or Glasgow Coma Scale, a low level of awareness, and you can proceed through the examinations that you feel are appropriate. So we would want to look at their airway. They're not breathing normally, they're not protecting their airway. We evaluate their breathing, that they, again, are not breathing normally, but they are moving air into their lungs, and the lung exam itself is normal. We look at their circulation, that they have normal circulation on examination. And you move through this, or your learners do, to choose everything that's appropriate for this specific scenario. So I would want an examination of the head, which shows a hematoma and a laceration. I would want a neurological exam, which shows that the patient is unconscious, but moves everything when you perform a painful stimulus. I'm going to omit some of these actions here so you can see what happens if I miss something. But now we move on to stabilizing the patient. And this is an unresponsive patient. So I want IV access in this patient. And since they are not protecting their airway, I want to consider intubating the patient. So you can proceed through this progression to intubate the patient. And I'm going to perform this action virtually now. So now you have the patient intubated, their airway protected, and you can proceed with further evaluation. In this patient, we've already seen that they have signs of trauma. So there may be things that you want to get in terms of imaging. I would obtain a scan of the head. You may want to scan the spine as well. You may even consider scanning the chest and abdomen because we have no idea what happened to this patient. So I'll proceed, at least for now, with the scan of the head and the neck. And you'll see here that image is coming up now. You may recognize the diagnosis just based on a first glance, that this patient has significant intracranial bleeding or an epidural hematoma that is developing with associated shift. So this patient is experiencing a neurosurgical emergency that needs an operation. There are other things you may do as you prepare to transfer the patient to the operating room. And in this case, we would also get certain blood tests that we would evaluate for any underlying trauma and assess the patient as they were being prepared for the operating room. So I'm going to put some basic labs in here as well. And when you perform those, you'll receive a result, again, read out over here. Here we're showing an elevated alcohol level. Now, in terms of interventions, what are you going to do for this patient? This is an unresponsive patient who has a neurological emergency and epidural hematoma on their scan. So you have already intubated them. You may consider performing some form of sedation after they're intubated. In the United States, we would typically use propofol for that. You may also need to consider a medical management of their neurosurgical emergency. So in someone with rapidly increasing intracranial pressure, an option for medical management is the administration of hypertonic saline or mannitol. And so we would perform that as well as we wait for the patient to go to the operating room. Finally, this is something you should recognize as being a neurological emergency that needs a neurosurgeon to decompress the blood in the brain. So you would contact the neurosurgeon and they recommend transfer to the operating room. Now, another key piece is your diagnosis here. In the differential tab, you'll go through what you think is going on with the patient, and the student will select what they believe to be the diagnosis. They can select a number of different things, but then they have to choose in the end their final diagnosis. So we have from the scan our diagnosis of an epidural hematoma. And in the end of the case, we know that we are going to send this patient to the operating room. And this is their final diagnosis, their injury, and the reason for their abnormal mental status. So in the end, when you close the case, it gives you the chance to go back if you need to. And I've omitted several actions, so you'll see that we don't have a full score in this case, that we haven't successfully completed everything that's critical. And when you finish the case, you'll get a result, a detailed result of your diagnosis, a detailed result of what you did and did not do. So in this case, I have the correct diagnosis and I have the correct disposition, sending them to the operating room. But I did miss several things that are important. And if you go into physical exam, for example, you see that I did not perform a trauma survey on this patient to evaluate their neck, their abdomen, their back, and all of those we felt were important in this case. Each action has an explanation for why we feel it's important and relevant to the case. And you can do this with each set of actions, and the instructor on our dashboard can see what the student has performed and what they haven't. And the last piece of each case is a detailed discussion that teaches them about the diagnosis and about what they should have done to manage the patient through the case. So now that I've walked you through the case, and you can try this on your own at app.full-code.com. And this case is free and available to everyone to play. So now that I've performed that, I'm going to show you our dashboard briefly. We have this will show you what the educator's view of the student's performance is. So if you have this for your group at your institution, you'd be able to see what I just performed. So I'm going to log in, and this is the dashboard view. This is the student that we played under, Roberta Austin. So you can see here that she just completed the case. That's the case that we just finished, and the score that she achieved on that. You can log into her specific case, and you can see that we got this score of 80.1%. You can dive deeper into that and see exactly what we did. And so this is the progression of actions throughout the whole case, what we did first and how we proceeded to evaluate the patient, and shows us exactly what the student did. So you can, in someone who is struggling or someone who needs additional help, you can understand what their thought process was and exactly what they missed, what they did or did not do. Lastly, I want to show you how we make these cases. And this is an option for some organizations who want to create their own cases. As I've mentioned, we have 120 cases in our library, 125 currently, with the last one being released last week. And these cover a very wide range of topics in trauma, emergency medicine, infectious disease, pediatrics. So there is a wide range available in the library itself. But we do have some organizations that decide to make their own cases, and they generate the cases using our case designer. I'm just going to briefly show you also that we have our pediatrics environment and a set of about 25 pediatrics cases as well. So lastly, I want to show you that designer, how we make these cases and build them, and I'll load up the case that we just played. And so this, for certain organizations that have the desire to create cases that are specific for their students and for their particular hospital system or environment, this allows them to write the case or change it in their own way. So you can see the discussion that was reviewed for each student and change that. You can change aspects of the patient's presentation and their history. And then you can decide on the scoring. You can decide what things we think are important, what things should and should not be done. And we use all this on the back end to create each case. So again, you can play all of our free cases, and there are 8 of them, at app.full-code.com and explore them on your own. If you're interested in talking to us about using it for a group or for a medical school or for a residency, you can certainly contact us and we can talk to you further about different options. The app itself is available for download on the Apple and the Google stores and work on most devices, including many tablets, as well as on the web browser, where you can use it on Google Chrome or Apple Safari. If you wish to subscribe to the full library, there's a paid subscription that's available in the application that you can pay for through the Apple or Google store. We have one option that is for 25 cases, and one that is for the full library of 125. And each of these is a monthly subscription. So you can subscribe through the Apple and Google stores if you wish, but if you're interested in working with a group, feel free to reach out to us. And we're very happy to work with organizations around the world and to find a good match for your budget and for the local currency to make sure that it is something that's affordable for you and for your learners. So with that, I think we can transition shortly to a question session, and I'm happy to take questions about the platform itself, about virtual simulation, or anything else you might want to know. And we do have our sales director here as well that can answer questions too. So thank you so much for having me.
Thank you so much, Dr. Joshua. We have a few questions and comments. Assuming that the intubation behavior was good, how to develop intubation skills?
That's a great question. So we have, our focus is on the critical thinking of how to make decisions in the specific situation, what is right and wrong to proceed with, and in the context of a diagnosis. So that our focus is on allowing students to practice those decision-making skills. And so in this environment, the actions are performed for you. So we're not teaching you how to perform a procedure itself. And I think that that is an absolutely critical aspect of in-person simulation and clinical learning in the hospital setting. But we don't focus on teaching you the procedure itself. This is about the clinical decision-making and the medical management.
Awesome, thank you. And do you have a specific case for the realization of the central pathway?
Sorry, can you clarify that, Kiara?
Do you have another cases specifically for the central pathway? Or what kind of cases the app have? Because you show us the intubation Do you have another?
Yeah, so we have a very wide range of cases in the system. I'm showing you right now one of our pediatric cases, but we have a large number of categories that includes neurological emergencies, infectious diseases, cardiac presentations with cardiac arrest, allergic reactions with anaphylaxis, as well as OB emergencies with pregnant patients. So it covers a very wide range of different types of presentations. Some patients will be healthy and well, and you will select a treatment and discharge them. And some patients will be critically ill. You may need to defibrillate them, to resuscitate them, to put them on blood pressure or pressors, to give them antibiotics, or to perform a range of different diagnostic tests. So this covers a large range of patients. And I just want to be clear, it's not just for CPR or for cardiac arrest. It's for all sorts of different kinds of medical presentations and trauma and other emergencies.
Thank you. I'm going to read to you some comments. Excellent simulator. Seems very useful and very good for practice and to see the reaction in emergency situations to evaluate knowledge. Thank you. Thank you so much again, Dr. Joshua, for sharing with us your knowledge and to show us this amazing app. We want to present our recognition for your amazing presentation. I'm going to ask you to stop sharing your screen. We're going to share your recognition.
Thank you very much, Kira.
Thank you. University of San Carlos of Guatemala, School of Medicine, Virtual Education Coordinator, present the following recognition to Dr. Joshua Feblowitz for his participation in the virtual fair of the first International Congress on Technology for Medical Education, presenting the software full code. Thank you again for your time and for being part of this amazing event.
Thank you, and thank you everyone for watching. And I just wanted to say one last piece of information. We would love over the next year or so to work on Spanish version of Full Code and to collaborate with professionals internationally. So if there's anyone who's interested and is fluent in both English and Spanish, we would love to work on that with you in the future. Thank you so much for having me, and thank you for your attention, everyone.
Thank you, Joshua. How was your experience? How you feel right now?
That was great. Yeah, thank you so much for having me. Are we still broadcasting or no?
No, don't worry.
All right.
Kiara, is it, would it be possible to, do you have an attendee list from the conference?
Can you repeat the question? I'm sorry.
Do you have